Bring your arms down. Both arms behind you. दोनों हाथ पीछे. Inhale. Lift the spine. Open shoulder and just look up. Inhale, come back. Exhale, palm on your knee and squeeze. Suck your belly and look down. Relax. Again, both arms up. Inhale. Finger lobe, palm facing up. Stretch your arms and just look up. Exhale. Bring your arms down. Both arms behind hip. दोनों हाथ hip के पीछे. Same. Lift the spine. Open shoulder. Drop shoulder and just look up. ऊपर देख. Inhale, come back. Exhale, palm on the knee. Squeeze, suck your belly and look down. And now relax. Open arms to your shoulder level. दोनों हाथ side में. Left hand left side. And right arm straight over the head. Come back. Inhale. Exhale on the right side. Now left arm straight. Come back, inhale. Exhale once again on your left side. Right arm straight. Come back, inhale and exhale on your right side. Left arm straight over the head. And now relax. Come back, inhale. Exhale, just right hand, left knee. Left knee near hip, twist, look back. पीछे देखिए. Gentle. Come back, inhale. Exhale, turn on your right side. Look back. Come back, inhale and exhale again. Turn on your left side. Come back, inhale and exhale. Turn on the right side. And now relax. Keep your both legs straight here. A little open legs, put a little gap, here, and move your legs. Move your knees up and down. Legs closer. Toes facing point. And then flex your feet. Toes facing point. And then flex your feet. And now make a rotation, angle rotation. Anti-clockwise, opposite rotation. And just relax. Coming over the front. Feet together. Hold your feet and swing your knees together. Knees up and down. Place your palm on the knee and slowly push your knee down. 1, 2, 3, 4, 5, 6, 7, 8, 9, and now 10. Relax. Bend your both legs. Keep your both legs straight. Legs together. And just very gently twist left knee near hip. Right hand on the left leg. Twist and look back. Come back, inhale. Exhale, turn on your right side. Come back, inhale, and exhale. Turn again on your left side. Come back, inhale, and exhale the same on the right side. And now relax. Bend your both legs, knee and your feet closer, and put your hands behind of your feet. Inhale, open shoulder. Exhale, then very gently lift your feet and roll it. Come back, inhale. Exhale, push your feet down, squeeze, and look down. Once again, inhale, lift your hip, open shoulder, drop your head. Inhale, come back. Exhale, squeeze, suck your belly and look down. And then relax. Come in the cat posture from here. Knee and feet closer. Inhale, push your hip out, open shoulder and look. Exhale, squeeze, suck your belly, look up at the navel point. Inhale, push your hip out, open shoulder and just look. Exhale, squeeze, suck your belly, look up at the navel point. Come in the downward dog, your legs, arms and your spine straight. Come in the upward dog, drop your knee down, push your hip down, push your chest in between arms and then look up. Once again, come in that downward facing dog, your legs, arms and spine. And come in the upward dog, drop your knee down and push your hip down, open shoulder and just look up. And then relax. Again, cat pose, knee closer, open your feet and your feet just come in between your bones and just sit very gently. Just for 2 seconds. 1, 2. Someone is finding some difficulty, knee pain, ankle pain, so you have that block. So you can put the block under your feet. But if someone has an extreme pain and an injury in the knee, hip, ankle, so please avoid this posture. Totally avoid it. 4, 5, 6, and then relax. From here, just a little over the knee, and everyone bend forward. Stretch your arms, stretch your spine, and just hold for a few seconds. Okay, guys, please sit down, bed here. You can keep your both legs straight here, and you can relax your legs. So we will be continuous today. So yesterday we we talk about the prenatal yoga, we talk about its importance, and we talk about the different three trimester, and we also talk about like what are the changes particular during this time, and what are the tests going on, what are the something belong to the hormones and that. And I already share that all the presentation, I already share all that slides with you all, which we did yesterday. तो अब थोड़ा सा आगे चलेंगे. Now we'll be a bit move further. Yesterday, doctor, she was explain about the optimal fetal position. अब वहीं से हम थोड़ा सा इसको लेके चलेंगे. We'll go further. It is visible. Yes, Rashmi. रश्मि ने मुझे सिग्नल दे दिया. Yes. So yesterday there was there ki what is the optimal fetal position, and one of the doctors he explained also about it, like the baby position when the head down and the bottom up. So occipital anterior, I also shared that slides with you all. The baby has a different position, even the baby head down and the bottom up. Even उसका baby का जो head नीचे है और उसका bottom up है, लेकिन उसके अंदर भी different positions होती हैं उसके अंदर. That you already saw in that all that slides. So there is a one occipital posterior position. This is the same position. Also as a head down presentation, only the back of the head is against the mother back. लेकिन जो बेबी का जो हेड है, बैक ऑफ द हेड है वो मदर की बैक की तरफ में होता है. So that is, this position is less favorable for baby and mother. So as per the doctor terms, because it can be have some complications and it can take a bit longer time for the labor, for the childbirth. तो ये जो पोजीशन है दैट इज द सेम पोजीशन, लेकिन इसके अंदर जो ऑक्सिपिटल पोस्टीरियर का जो पोजीशन जो बताया गया है, इट मींस उसका जो हेड का जो बैक है दैट इज ऑन द मदर बैक साइड की तरफ होता है. सो एज पर दिस टर्म, बेबी टेक्स लॉन्गर टू मैन्यूवर थ्रू द बर्थ कैनाल एंड कैन लेंथन द टाइम लेबर एंड द पुशिंग, एंड इट इज समटाइम्स डिफिकल्ट फॉर हेल्थ केयर प्रोवाइडर्स टू नो what position the baby head is in. They can usually tell if a baby is in a head down position, but the rotation of the head is more likely found by where the mother is feeling kicks and buggles. With the help of contraction and mother movement, OP babies can turn in labor to a more favorable position. तो बस उसी positions की ये बात कर रहे हैं कि if the head back का जो उसका जो position है that is the same side of the mother back, so it is quite complicated situation. और उसके अंदर जो है in that situation for the childbirth is take longer time. तो इसके अंदर जो इसकी कुछ position है उसके अंदर some movement can be helping to turn an OP babies. तो यहाँ पर here we will be combined some yoga movements and some yoga poses and some kind of the practice which can be help to turn and the OP babies. जो इस तरह की जो position जो जिसके बारे में हमने अभी डिस्कस किया, तो उस पोजीशन को हम कैसे उसमें मूव कर पाएंगे. So these positions are inversions can be helpful to make the pelvic floor more symmetrical. Side lunge practices some pelvic floor release, sacral release, and the cat cow can help a head rotate to a position that is more favorable. So this is more likely to be effective if the woman is already in labor or the baby is active while performing this movement. तो ये जो पोजीशन इसमें बताएगी, I let you take the directly on these positions. So these are the same positions, like these positions can be helpful for that. तो इसके अंदर you can be see the cat and cow positions is mentioning, and even some position is mentioning like the cat position with the drop elbow, or some position is in the standing way, like with the open legs and hands on the thigh. So this position can be helpful. एक बार इसमें हम वापस चलते हैं. So this position later on we will be have the one, I will have the complete one script about it. उसका पूरा का पूरा मैं आपको मैं script भी आपको मैं दूंगा कि how and you have to be practice. First you have to practice as a teacher so that you can be understand, and then same practice you can be give to your students whoever have this kind of the situation, so that you can be guide your students in this kind of the position. So you can be see here. So this is the cat and cow, and another one is the standing. Cat and cow can help a head rotate a position that is more favorable. However, this is more likely to be effective if the woman is already in the labor or the baby is active. So ये जो movements हैं, that movements it should be like before the labor time. So this is the one another like breach and transfers babies. A breech baby is a baby who is presenting with the bottom down and head up. So ये जो है ये that is quite another one complicated situation during the labor time. So इसके अंदर in this position baby bottom down, उसका bottom नीचे होगा और head उसका ऊपर की तरफ. So many doctors are uncomfortable delivering breech babies and will automatically do a cesarean if a baby is breech. So breech ka firstly we need to be understand, breech means when the position of the baby bottom down and head up, that's called the breech baby. So there are several different kinds of breech presentation. So breech babies की जो positions होती है, almost breech baby conditions doctor usually refer to the cesarean delivery. तो इसके अंदर भी कुछ टाइप इसमें बताई गई है. There are several different kinds of the breech presentations. Frank breech. A Frank breech baby is baby who is sitting in the pelvic with the bottom down and the feet up by the head. जो pelvic के अंदर जिसका bottom down और उसके जो बच्चे के जो feet हैं, feet up by the head, and this is the most favorable for vaginal delivery. Though there are still many healthcare providers who will not do vaginal delivery of a Frank breech baby. Complete breech baby is one who is sitting cross-legged in the pelvic with the head up and legs and bottom down. And footling baby, a footling breech is the same as a complete breech with the exception of one leg hanging lower than the other. Very few people attempt a vaginal delivery with this kind of presentation. So usually जो breech की जो position होती है, almost in the breech baby position, doctor usually refer to a cesarean delivery. But इसके अंदर भी कुछ क्वेश्चन इसमें बताएंगे कि how some movements can be helpful. So these positions can be helping positions and techniques for turning breech babies. I think whatever the pictures is showing here, ये एक बार आप लोगों को भी ये प्रैक्टिस करनी पड़ेगी इसकी, यू विल हैव टू बी प्रैक्टिस विद दैट. So forward leaning inversion is similar to downward dog, but the angle is a bit more drastic. This can be done on a couch or bench with elbow on the ground or on the stair. Both require supervision and should be done for about 30 seconds and followed by the bridge. So this position can be practiced like जो आपके पास कोई sofa होगा, table होगा. So during these positions ये practice जो है that can be helpful for turning the bridge babies, ताकि उनका जो position है उसको turn करने में ये थोड़ा सा helpful रहती है. And the another one, the bridge tilt, moving into a bridge position with support under the hip and legs up the wall. This can be further helped by using a cold compress near the baby head to increase rotation. तो इसमें जो मेनली इसमें दो पोजीशन आपको ये बता रहा है इसके अंदर, पोजीशन टेक्निक फॉर द टर्निंग ब्रिज बेबीज के लिए. एक द वन यू आर सीइंग इन द पिक्चर लाइक हियर, दिस इज एग्जैक्ट लाइक द डाउनवर्ड डॉग, लेकिन इन्होंने थोड़ा सा मॉडिफाई किया इसको, तो एग्जैक्ट डाउनवर्ड डॉग पोजीशन कैन बी हार्मफुल especially on this in this time. So they are just giving this position which can be helpful. And the another one, this is just lying against the wall, जिसके अंदर you have to be put some pillow, some kind of the cushion under the hip, and another cushion can be put under the back. So ये जो position, this position can be helpful. Do you want to be try? Practice करोगे इसकी एक बार, करके देखोगे एक बार फील करके देख लीजिए. You just assume, come on. So you guys have some kind of the table or not with you? एक बार I do not have. Please arrange some kind of table. Tomoko, you please do not do it. Tomoko, you do not practice. आप practice मत कीजिएगा. No. And the one another student, I forgot her name. She was pregnant about I think 4 months. वो भी मत कीजिएगा. She also please do not do it. She just only watch. हरवीर जी आप कर सकते हैं, आप कर सकते हैं. हरवीर, रंजन, you can be try. Divya, you please only watch. Because पहले आपको भी उस पोर्शन के बारे में पता होना चाहिए, maybe. And this portion is you do not need to be teach on the straight away. Someone pregnant, you don't need to be teach that आपको ये practice कीजिएगा. So this is just some condition. When this condition is arising, only that time you can give this kind of the positions to. So firstly you have to be experienced with that. You can get some kind of detail. So पहले you just can take the position in the cat. Directly मत लेके आइए, because directly actually this position can be so much strain and so much compress can become the cat. So you can be give them the technique. Technique is also very important whenever you teach any movement, you are teaching any asana. Particularly when you एक asana में जाना कैसे, that is very important. Straight away you cannot take anyone in the position. Even when we normal we are practicing, so we are also finding this kind of things. So just drop elbow and then it can be like bending the knee, और उसके बाद that can be like. So you have to find, because different bodies can be have a different level. So ये fix में is not fix, you have to just do the next thing. So might be you have to change the modify. Maybe they are not feeling so good, comfortable, can be drop, bend the elbow, bend the legs, and that can be fine. Because in this practice, so much pressure is also coming on the shoulder side. And this is also mentioned here maximum they have to be hold only for the 30 seconds. So this thing also you need to remember, 30 seconds they just said, but this is also not a fix. Maybe sometimes you will have a case, you have a situation, after even 10 seconds, 15 seconds, they are finding themselves very much complicated. So this can be up and down. Maximum can be 30 seconds, minimum can be defined as per the different body condition. So you can be try one more time. Second position is have to be against the wall. So उसके अंदर you have to put some a bit one pillow under your hip on the pelvic and one another under your spine, so that you can give the support to the pregnant lady and of course pelvic. You will have the pillow with you. होगा आपके घर में आएगा so no fine actually let's try to understand ये जो position जो हम अभी कर रहे हैं these positions is only for particular some condition. जब कंडीशन ऐसी आती है स्पेशली व्हेन फाइंडिंग द बेबी पोजीशन लाइक बॉटम डाउन एंड द हेड अप ब्रिज पोजीशन, तो उसके लिए स्पेशल ये चीजें बताई गई. बट ड्यूरिंग द टाइम व्हेन यू आर टीचिंग पर्टिकुलर योर स्टूडेंट्स, दैट टाइम यू कैन जस्ट गाइड देम. That time you just guide them because that time you are giving them the practice in the downward dog and this practice, so that is fine. This portion especially mentioning ये जो portion है especially सिर्फ उस केस के लिए mention की गई है in when particular have this condition, this situation is arising. ये रूटीन में नहीं करवाने की जरूरत है, रूटीन के अंदर नहीं करवाना है. रूटीन you do not need to give this practice. This is just only for your information so that your student she know particular. इस सिर्फ उस situation के because अगर कोई ऐसी situation आती है, when the situation arise, so in that time your student know what she can be do. रूटीन में तो अभी हम आएंगे सीक्वेंस के अंदर. रूटीन के अंदर you are giving them the downward facing dog because when your student, when pregnant woman is able to do the downward facing dog normal condition, so it will be much easy for her. She know how to do the downward dog when she was in the second trimester or in between the third trimester, because you are giving her that kind of practices. So her body is already used to give this kind of practice. So in some situation when the कोई situation आती है, so that time she can be used this one and she can do easily. Problem कब होगी कहाँ पर? When the problem arises, when she do not know and if someone do not know how to practice it, and suddenly when you are giving this kind of the practice, उस time that situation is very much tricky. But you already trained your student, आपने already training दिया है particular all downward facing dog, different portion of the idea, the some more portion will come during to go step by step, then it will be much easy for them. उनको आसानी से वो ले पाए. ये तो बस आपने एक information दी. इसका जो दूसरा जो प्रैक्टिस है, that practice can be done. You need the one pillow and you need some under your spine. आप एक बार ले आइए एक पिलो और एक one kind of the blanket you can, or if you do not have that blanket, so you can fold them. सभी लेके आइए. उपकार तो पोजीशन में बैठ. उपकार, you have a very good experience, right? Okay. I also felt. So it's mentioning one pillow height a little bit bigger and the another one a bit smaller. दोनों का साइज एक नहीं रखना, The one a bit bigger and the one a little slower because as per the condition. Actually, I do not have so many things at my home. I have very small home here. So the position is the hip will be to the wall. Actually, this is quite big. If you have the cushion like the round pillows type cushion type, that is a much more helpful. So this is the one another position. Same height, it's not recommended. Under your pelvic, under your hip, the pillow size a little bit bigger, and then under your spine, under your lumbar, it will have a small size. उसके अंदर you can be use some kind of a blanket को थोड़ा सा fold करके आप कर सकते हैं. Block is not recommended because block can be hurt their spine. वो नहीं करना आपको. Only this position can be. Hands can be. This portion you can also teach in your second and the third semester. वो हम आएंगे then will be. Or even when you feel tired. अब इसको दूसरे टॉपिक पर लेके जाते हैं. If someone have a standing job, सारा दिन खड़े खड़े होने की आपकी जॉब है तो you can be give this practice. Even you can practice. Mansi, yeah. Okay. ओके आ जाइए वापस आ जाइए. देखिए आपको भी थोड़ा सा रेस्ट मिल गया बीच के अंदर. You all guys have a little rest in between. थोड़ा सा आगे चलते हैं. Hips will touch the ground. Hips ground को कैसे टच करेंगे? Because under your hip you are using the pillow. हिप के नीचे तो आपके पिलो आ गए ना. या तो हिप थोड़ा सा आपको वॉल को टच करेंगे, ग्राउंड को टच नहीं करेंगे. बिकॉज यू आर पुटिंग द पिलो अंडर द हिप. So now we come on our next topic. Slowly we are reaching to our next topic. Prenatal yoga modifications and the yoga precautions. So take a look around the next yoga class. Notice that each person, each body is different. It might be totally appropriate to ask one person in class to place a leg behind their head because their bodies have demonstrated the ability to do so. Here they just are saying that whenever you teach, even you are teaching in the second semester, so some practice, it's not like if you design particular some sequence, so each and every sequence or each and every asana, every movement is suitable for everyone because everyone have their own level. कोई भी एक प्रैक्टिस अगर हम चूज करते हैं किसी भी क्लास में करवाने के लिए, नॉर्मल कंडीशन में भी अप्लाई होता है. इवन इन द नॉर्मल कंडीशन व्हेन यू आर टीचिंग द योगा क्लास, तो जरूरी नहीं कि whatever you are teaching that is suitable for each and every one. वो हर कोई उसको कर पाए. So that's why you should have some different modification in your hand. On the other hand, asking that same thing to the person next to them who was would become irresponsible and would cause injury. The logic that you already used in the yoga class with no pregnant people carries over to working with pregnant women. There are some pregnant women who can easily move into poses that. So they are also talking about the same thing. Main thing when you are teaching the class, you better you take special class only for the pregnancy, prenatal yoga. समटाइम्स दिस इज द वन कॉम्प्लिकेशंस यू आर फाइंडिंग. कई बार क्या होता है कि आप नॉर्मल क्लास आप टीच करते हैं, उसी के अंदर यू आर फाइंडिंग सम प्रेग्नेंट वुमेन, शी इज आल्सो प्रैक्टिसिंग दैट टाइम. तो उसके अंदर भी समटाइम्स इज आल्सो हैपनिंग, सम काइंड ऑफ द कंपैरिजन इज देयर. तो ये थोड़ा सा ध्यान रखिए व्हेन यू आर गेटिंग सम चांस टू टीच द prenatal yoga. So better you try to make your batch or make your group separately than your normal classes. And this is also saying that some pregnant women who can easily move into the poses, and other women can be hard themselves attempting means. कुछ होते हैं कि कुछ प्रेग्नेंट वुमेन दे कैन बी डू ईच एंड एवरी पोज, वो आसानी से कर पाते हैं. और कुछ ऐसे भी होते हैं कि दे कैन बी टेक सो मच टाइम एंड दे आर they finding themselves very challenging in that. This is why it's so important for pregnant women to listen to their body and only do poses that feel good and not try any advanced poses for the first time. So this is the same thing we also talking whenever we teach any normal yoga class. अब नॉर्मल योगा क्लास के अंदर भी जब हम बात करते हैं तो वी आर आल्सो सेइंग द सेम थिंग कि व्हाटएवर यू कैन बी डू, you just whatever your body is allowing you, you only follow that. You don't need to be find, and you don't need to be like a comparison, compare yourself with another. तो यही चीज इसमें बताई गई कि उतना ही कीजिए जितना आप कर पाए. You do not need to be hard for yourself. अपने आप को no need to be give pain to yourself. अपने आप को torture नहीं करना. They feel good and new advanced for the first time while pregnant. No need to be teach any kind of advanced. That's why we are learning. I will give you that particular sequence. फर्स्ट ट्राइमेस्टर की भी थोड़ी बहुत मूवमेंट्स में आपको मैं बताऊंगा, एंड देन सेकंड ट्राइमेस्टर द थर्ड ट्राइमेस्टर, और धीरे धीरे उस मूवमेंट के ऊपर हम जाएंगे. बट व्हाटएवर द मूवमेंट इज देयर, इवन समटाइम्स सेकंड ट्राइमेस्टर, इवन द थर्ड ट्राइमेस्टर, तो दैट ऑल डिपेंड्स ऑन पर्टिकुलर बॉडी टू बॉडी. ये कोई जरूरी, दैट इज नॉट ए फिक्स थिंग कि यही आपको करवाना है और यही उनको करना पड़ेगा, ऐसा कुछ भी फिक्स नहीं. दैट इज जस्ट द सीक्वेंस व्हिच यू कैन डिजाइन, व्हिच यू कैन बी टीच. समवन कैन नॉट डू, यू कैन नॉट बी फोर्स्ड. Exercising while pregnant. Everyone agrees that staying active and exercising while pregnant is the best way to maintain women's health and fitness and prepare her for the often strenuous and challenging for childbirth. So they are just talking about the importance of exercising. Exercising means exercising, we can be say all the like the stretches, the movement, and you can be say the prenatal yoga. So this is, ये बहुत ही अच्छी चीज है if they practicing with that woman की health और fitness को बनाए रखने के लिए. And this practice can be very much helpful for challenging of the childbirth. During the time of delivery, it can be have very beneficial. But starting a prenatal exercise program can be hard in the first trimester, conception to the 3 month. So here they are again reminding again and again कि जो first जो 3 month होते हैं, that can be a very much challenge and very much hard, because first 3 month have a lot of changes inside the pregnant woman. Body का change होना, fatigue, nausea, dizziness, a lot of symptoms of the vomiting. So that's why it's saying that the first 3 months can be very hard. Women often experience extreme fatigue and wearing dysplasia. Yeah, we already talk about it. Most healthcare providers and prenatal fitness experts will agree that women should listen to their bodies and rest during the prenatal period. So they are saying the first जो trimester है उसके अंदर कोशिश करें कि women अपने शरीर की सुने. They just try to listen to their self and try to be rest as maximum as they can. So that's the talk only here. Getting back to routine. Once the first trimester is over, then most women have spent a couple of months out of an exercise routine and are ready to start something new or resume their past exercise routine. जैसे फर्स्ट ट्राइमेस्टर फिनिश होता है, वुमन गेट बैक टू बैक. तो मतलब कि सेकंड ट्राइमेस्टर जो है, दैट इज अ गुड टाइम टू स्टार्ट एक्सरसाइज, गुड टाइम टू स्टार्ट the yoga practice. They come to their first class after doing virtually nothing during their first trimester. This is entirely appropriate since the number one rule to any prenatal activity. If it doesn't feel good, don't do it. So they are just saying that when they are coming after their second trimester start and when they come back on their exercise routine, and this is even the first time, still they are not feeling good, so don't do it. Even you are teaching to your student, so you are finding your student are finding themselves in a very difficult situation. They are finding something very hard. So being a teacher, you need to show your care and you have to be very patient with your student. They are finding they can't do it, okay, let them rest and give them something very gentle. Someone can do it, let them do it. Someone cannot do it, it's okay. So when they start slowly and listen to your body. Need to tell our students who have been out of an exercise routine for a while, because during the first semester usually is avoiding that practices. When they start back, they should start very slowly, start with 15 minutes once or twice a day. So when you are designing your own plan, each and every teacher can be design their own plan. Some here they are mentioning कि once they come back on the routine, सिर्फ 15 मिनट के लिए उनको आप practice दीजिए. Even they can be practiced 15 minutes twice a day. But this is not a fixed thing. You can be teach even 30 minutes, even you can be teach for 45 minutes, even you can be teach for a 1 hour. But that will be totally depends on your particular student. So if you are finding your students cannot be go more than 15 minutes, आपको लगता है कि आपके जो पर्टिकुलर जो स्टूडेंट्स है, प्रेग्नेंट जो स्टूडेंट्स है आपके, वो 15 मिनट से ज्यादा नहीं कर पा रहे, 20 मिनट से ज्यादा नहीं कर पा रहे, 30 मिनट ज्यादा नहीं कर पा रहे, so you can let them relax because their bodies have been changing over the last few months and are changing every day. The things that felt great before they were pregnant might not feel good at all now. So they are just letting know when they come back on their mat, because body during the pregnancy body is changing each and every day, and what they feel before, जो वो pregnancy से पहले feel करते थे during their exercise routine, and when after pregnancy when they start again their exercise, so might be they have the different feeling. Of course they have the different feeling, might be they will not feel good at all because the belly size increasing, they are finding some difficulty, they are finding some challenges. तो ऐसा होता है. तो being a teacher, आपको उनको motivate करना है. You have to motivate them, you have to be take care them, and you have to be very patient with them. ये नहीं कि मेरी तरफ शुरू हो जाए कि नहीं करो, ऐसे नहीं करना. You have to be do it. No, do not do with them. उनके साथ थोड़ा सा sympathy रखिए. You have to very much sympathize with them and very much kind with them. Every woman is different. Some women might need a few weeks of building up their exercise routine before they can do a full class. Others can do a full class right away, starting slowly and listening to their bodies. So they are also again showing the comparison between one body to the different body. कुछ cases के अंदर, in some cases maybe some women they need some time, they need certain time to come back on their routine, and maybe you will find some women they when they come first time on the mat after a particular time, and on the first time they are ready to do the complete class. So you can be find the different body, you can be find different bodies. So according to that you have to be give them your practice routine. जैसे ही आपके स्टूडेंट का आपको लगे उनका जो एनर्जी लेवल है, उनका जो स्ट्रेंथ लेवल है, उसके हिसाब से ही आपको मॉडिफाई करना है. दैट्स व्हाई वी आर टॉकिंग हियर मॉडिफाइंग योर प्रैक्टिस. Consult your doctor. The question is, when is the best time to start the prenatal yoga routine? So my answer is that there is no one right way when it comes to prenatal fitness. Every woman is different and is ready to start exercising when her body tells her it is time, as long as she has no complication. तो ये भी एक बात आती है कि consult your doctor, and pregnant has gotten okay from the doctor. So this is the very good way. If someone is coming to you, like you, she want to do the prenatal yoga and that, so your first reply to them, you should consult with your doctor. She has the consult with your doctor, and doctor can give advice to her, because particular जो doctor होता है, because doctor know the actual condition of their client. उनको पता है कि इसकी condition क्या चलती है, because doctor know कि कोई complication तो नहीं चल रही, complication in her body or not. what is going on inside, because doctor time to time they are doing some test, ultrasound and that, so doctor know that her body is ready to do particular some exercise routine or not. So this is a good way. ये नहीं कि she is coming to you, doctor saying कि no, you are not ready to do the yoga. You say no, no, कर लो, कुछ नहीं होगा. So you have to be very, very safe with this thing, because it happens sometimes. ये होता है, कई बार होता है कि when especially when you are teaching the prenatal yoga, when you teach the prenatal yoga, something happen. Maybe she has their own complication, but when she come in your class and after that something happens, so they will not hesitate to blame you directly. वो शर्माएंगे नहीं आपको blame करने की. So you have to be very, very safe side with that. आजकल एक there is a one kind of medical form is also there. उसको find out कर सकते हैं. I think student को पता भी होगा. So you should take that. You have to be fill up that form with particular pregnant woman. और उसको तो आप normal classes में भी आप उसको use कर सकते हैं. Even you are teaching the normal class or something happened with your any student, so they will gonna blame you. Waiver. Can you please send us that kind of the form? That kind of the form you should use in your each and every class, especially when you are teaching the offline classes. Online के अंदर तो कुछ नहीं फर्क पड़ेगा. Offline class, when you are teaching the offline classes, तो आप उस form को use कीजिए. You try to be use that form. उसके अंदर होता है कि भी you have any particular any disease, any problem, so yoga teacher will not be responsible if something happen this and that. वो सिर्फ आपकी सेफ्टी के लिए होता है. नहीं तो स्टूडेंट विल डायरेक्टली ब्लेम ऑन यू. दे वो अपनी गलती से कुछ होगा उनको, दे विल डू देयर ओन मिस्टेक एंड दे विल ब्लेम ऑन यू डायरेक्टली. एंड यू नो कि हाउ टू बी टीच. बीइंग ए योगा टीचर, ऑलमोस्ट योगा टीचर दे ट्राई देयर बेस्ट. सभी योगा टीचर कोशिश करते हैं कि वो अपना 100% देगा दे पाए. योगा इंश्योरेंस उपकार इन इंडिया के अंदर दैट इज नॉट फेमस योगा इंश्योरेंस, बट देयर सम काइंड ऑफ द फॉर्म्स आर देयर. वो मेडिकल रिलेटेड कुछ फॉर्म होता है, आई थिंक वो आप फाइंड आउट कीजिए एंड सेंड इन द ग्रुप. अंकिता आपको पता है, अंकिता ने गर्दन हिलाई, यू नो. ओके ओके. इफ समवन नो यू हैव दैट फॉर्म, प्लीज शेयर इन द ग्रुप एंड आई विल शेयर विद एवरीवन. एंड प्लीज स्टार्ट यूजिंग दिस काइंड ऑफ द फॉर्म. वो आपकी सेफ्टी के लिए होगा. नहीं तो कोई आएगा और कहेगा मैं आई जस्ट डिड द क्लास विद पर्टिकुलर दिस टीचर एंड आई गॉट दिस प्रॉब्लम. तो उसका थोड़ा सा आपको ध्यान रखना. So this typically occurs at the beginning of the second trimester, but some women can exercise during their first trimester or not start until the third trimester. So they are mentioning some women standard advice to start the prenatal yoga or any exercise movement from the second trimester, from the after finish first 3 months. But some situations, even the first trimester women also start practicing. But there are also some situation, कई बार ऐसा भी situation आता है कि there are some particular some bodies even in their third trimester they are not able to do. तो it totally depend करता है particular body to body conditions के ऊपर. It will totally depends on different body conditions. But here our advice is, being a teacher, if it feel good to exercise even during your first trimester, take it easy, don't push yourself and consult with your doctor. Doctor से consult कीजिए पहले. You have to be consult with a doctor, or even in the first trimester you can. But later on I will be guiding in first trimester what kind of the movement and what kind of the breathing practice you can give to a student. And remember also, if you are giving practice in the first trimester, कई बार होता है some crazy women are there, so they want to be practicing in the first trimester. They say no, I am feeling good, I want to go for it. So give them maximum 30-40 minute practice. Do not give them more than that. उनको ज्यादा लंबा practice देने का जरूरत नहीं है. 30 minute practice just sitting and just lying back with their spine, back के साथ उनको लेटा दीजिए और बस gentle practice. वो हम बाद में बात करेंगे. So here they are talking about first trimester and some precautions. Do not overstretch. Flexing the body can cause instability in the joint and connective tissues. ज्यादा ओवर स्ट्रेच उनको नहीं देना है. Just in the simple way, pregnant women should be able to maintain normal ujjayi breathing without getting out of breath as they practice. Ujjayi breath, everyone knows, this is about your uh, complete breathing, but even they practice with the ujjayi breath, that breath should be without any strain. उसके अंदर किसी भी तरह का there should be no forceness should be there. Dehydration can cause contraction. Any pose that cause discomfort should be avoided. Move into every pose slowly and mindfully. यही बोल रहे हैं कि whatever the pose you are teaching them, it should not be feel discomfortable. Easy and slowly going should be there. Gentle तरीके से posture के अंदर जाना. Anytime they are finding some difficulty, let them stop. Although most yoga practice encourage not eating 2 or 3 hours before practicing, but pregnant women should have a light snack, like some apple or fruit, nothing hard to digest. Means practice से पहले भी, because we are not giving them some kind of the hard practice. हम कोई hard practice उनको नहीं देंगे. So before even the practice, they can have some kind of some piece of the fruit they can be eating, because that can be easily digested for an hour before yoga, and should stop drink water if they are thirsty. Why they saying drink water? Because thirsty है that they can be drink, but usually थोड़ा सा stop कीजिए, otherwise वो because वो during the pregnancy you guys know कि that can be frequently urination का थोड़ा सा ज्यादा रहता है, so that's why they are this mentioned. Poses to discontinue. Any pranayama with rapid breathing or breath retention is Kapalbhati. कोई भी जो प्राणायाम है जिसके अंदर रैपिड ब्रीथिंग हम करते हैं, एग्जांपल लाइक द भस्त्रिका प्राणायाम वी आर डूइंग इट, सम काइंड ऑफ द कपालभाति प्राणायाम वी आर डूइंग इट, इसमें थोड़ा रैपिड मूवमेंट रहता है आपको इसके अंदर. प्राणायाम कैन डू इट, बट इट कैन बी जस्ट वी जस्ट टॉक अबाउट द काइंड ऑफ द ujjayi breath style. Pranayama can be, pranayama is recommendation, but it's only just the your inhalation and your exhalation process should be there. That's, or even you can teach the anulom pranayama. Here they are mentioning or breath retention. Anulom vilom pranayama and nadi shodhan pranayama. You all guys know, I think so. Anulom vilom can be doing, but not recommend the nadi shodhan pranayama. Both is called as the alternate nostril breathing. दोनों का जो टेक्निक है वो सेम है, द बोथ टेक्निक्स आर द सेम, बट इन द नाड़ी शोधन प्राणायाम वी आर यूजिंग द रिटेंशन. उसके अंदर हमारी होल्डिंग आ जाती है. होल्डिंग हैज अ डिफरेंट काइंड ऑफ, उसमें दैट इट्स गोइंग ऑन द डिफरेंट रेशियोस ऑन दैट. यस, चंद्राभेदी प्राणायाम कैन बी डू इट. यस, भ्रामरी कैन बी डू इट. दैट इज सम बेसिक प्राणायाम कैन बी. डिस्कंफर्ट कैसे होता है, मैं समझा नहीं आपकी बात को. डिस्कंफर्टेबल रैपिड ब्रीथिंग के साथ कैन बी द डिस्कंफर्टेबल. नॉर्मल ब्रीथिंग के साथ दैट इज टोटली फाइन. नॉर्मल इनहेलेशन एंड नॉर्मल एक्सहेलेशन. चंद्रभेदी प्राणायाम you all know that we call the left nostril breathing. Yes, she is talking the Shitali pranayama. All the basic pranayama in which you are not using any kind of the rapid breathing and not using any kind of the retention, you can be go with that. Yeah, we cannot be practice the forcefully pranayama. That what we are talking here. Rapid breathing के अंदर ही forcefully pranayama आते हैं, जैसे कि कपालभाति, भस्त्रिका. So we cannot be do it. दीपा, मैं आपका क्वेश्चन समझ नहीं पाया. what type of discomfort? Let me complete this topic. First. What kind of discomfort? तो उसी की तो बात कर रहे हैं हम कि rapid breathing can be have the discomfort during the practice. So basic pranayama, you guys already talk about it. your no pranayama, you can be doing with Brahmari pranayama, you can be doing simple inhalation, exhalation, you can be doing Chandragadi pranayama, can be do it. Abdominal exercise that target the repetitive overuse of the rectus abdominis muscles such as sit-ups. तो एब्डोमिनल एक्सरसाइज एक्चुअली जो कोर स्ट्रेंथ की जो आपकी जो प्रैक्टिस है, सिंपल लैंग्वेज में लेके चले, जस्ट फॉर द सिंपल लैंग्वेज, कोर स्ट्रेंथ की जो प्रैक्टिस है आपकी, दैट शुड बी अवॉइडेड. फॉरवर्ड बेंडिंग, स्टैंडिंग और सीटेड विद लेग्स टुगेदर. फॉरवर्ड बेंडिंग की जो प्रैक्टिस है, इवन स्टैंडिंग और सीटिंग लेग्स टुगेदर के साथ में, दैट हैव टू बी अवॉइडेड. स्टमक लाइन पोजेस विल स्टॉप. जो आपका जो स्टमक लाइन की जो पोजीशन जो है, दैट शुड बी अवॉइडेड. एंड मोस्ट बाउंड पोजेस, एनीथिंग दैट डजंट फील गुड. यूजुअली इसमें क्या होता है कि मेनली सिटिंग प्रैक्टिसेस कैन बी देयर. चलो इसके ऊपर थोड़ा सा हम करते हैं. सिटिंग प्रैक्टिसेस यूजुअली वी रिकमेंड एज मोस्टली लाइक joint movement practice. We usually recommend this in the, especially in the first time. Cases broke down. Broke down के first trimester में सबसे ज्यादा केस हो सकते हैं. Usually I never take any student, especially in the first trimester. मैं कोई भी स्टूडेंट नहीं लेता हूँ अपने फर्स्ट ट्राइमेस्टर के अंदर. आई लेट देम गो home and just practice by yourself. You can just teach them कि you can do some simple breathing and that. So this is just for the information only. Even you want to give this information, that can be simple. Your neck stretch movement, which we always practice, is your wrist movement can be there. Your simple shoulder movements can be there. And then leg straight movement can be there. But remember, legs not together with a little bit open legs movement you can be given. Forward bending, avoid karna है, बस sitting only. That can be moved, your ankle will move, the knee only. Simple things, that's it. And then better to let them lying down. Only उनको 15, 20, 30 minutes से ज़्यादा उनको practice मत दीजिए. Lying position in the sense, lying position के अंदर we can be simple like a arm stretch, but there should be no strain on the abdomen. That should be very, very gently, like here. That's it. Simple only. Bend the legs simply. And just simple press the knee. No need to let them pull the neck to your stomach side. Go practice नहीं देना, because that can be give a little pressure on the stomach, on the abdomen. So that all kind of practice, जो भी practice आपके stomach पर push करे, compression आए, या core strength की जो आपकी जो practice है, legs up and down, ये practice नहीं देनी है. Let them totally avoid it. Simple stretch can be लेटने के साथ भी आप use कर दे सकते. That's it. Simple bend leg can be like this. Enough. बिल्कुल gentle routine you have to be given. बैठने के साथ भी there are some practices. Arm can be stretched, arm can be behind. So these practice you can be given. अभी we have that sequence already. मेरे पास इसका पूरा sequence है. वो sequence में आपको पूरा slide आपके साथ में share करूँ. Pavan Mukh Asana. I just said Pavan Mukh Asana have different modifications. Pavan Mukh Asana, I just said we only just let them bend the leg. Do not let them strain, pull them into the stomach side, because जितना आप pull करेंगे, that can stimulate your stomach. वो abdomen को थोड़ा सा compress करेगा यहाँ से, and compression can be harmful. And when you are lifting the head and you're lifting the leg, it will give the more compression on the stomach. So उसको avoid आपको करना. It's not very much recommended. Simple करवा सकते हैं, you can simple bend leg and that's it. Even without any push, just simple, that's it, enough. बिल्कुल जेंटल तरीके से कहा ना आपको, फर्स्ट ट्राइमेस्टर तो बड़ा रिस्की होता है, दैट इज वेरी रिस्की। लेग रोटेशन बेटर आप बस थोड़ा सा लेग अप एंड डाउन करवाइए, क्योंकि लेग रोटेशन आल्सो इज गिविंग a bit strain and a bit practice on your core muscle too. सेकेंड ट्राइमेस्टर में आप करवा दीजिए, लेग रोटेशन करवा दीजिए, पवन मुक्तासना भी थोड़ा सा करवा सकते, लेकिन थोड़ा ध्यान रखना फर्स्ट ट्राइमेस्टर तो बिल्कुल इजी जी आपको लेके चलना पड़ेगा। ब्रिज पोस्ट, जेंटल ब्रिज पोस्ट कैन बी। अभी हम थोड़ा सा ये आज थोड़ा सा थ्योरी हम करते हैं बस, आई एम गोइंग टू बी फिनिश इन जस्ट 2-3 मिनट्स मोर, एंड फ्रॉम नेक्स्ट वीक वी विल बी गो विद अ कंप्लीट क्लास विद दैट। अगले हफ्ते से ना पूरी क्लास के साथ हम इसकी प्रैक्टिस करेंगे। सो आई विल ट्राई टू फिनिश ऑल दैट सीक्वेंसेस, एंड उसके बाद फिर हमारी फिर प्रैक्टिस चलेगी बैच के अंदर। Yes, can. Lying on back, feet on the wall square. Can. अरे रुक जाओ, अरे सारे रुक जाओ एक बार वी गो स्टेप बाय स्टेप, एक एक स्टेप कर लेते हैं फिर चलेंगे। वी विल कंप्लीट ऑल द पार्ट्स। लेट्स वी टेक द स्टेप्स वन बाय वन। ये सारी चीजें जो आप बता रहे हैं ना, मैं बाद में पूछूंगा आपसे, ध्यान रखना, बाद में बताना मुझे। यू ऑल, आई विल आस्क लेटर ऑन। लेट मी कंप्लीट दिस पार्ट, एंड फ्रॉम नेक्स्ट वीक फिर हम प्रैक्टिकल पर लेके चलें। So second trimester precautions, same as the first trimester precautions. If woman has been inactive first trimester, common due to fatigue and sickness, start a practice slowly, and give student permission to only do part of the class and rest child was off. So जो precautions जो है almost जो पहले बताए थे, that is the same, and if someone they did not did any practice the first trimester, second में वो practice करते हैं, लेकिन the same thing कि अगर वो cannot be go with a complete class, थोड़ा कर पाए, let them do a little bit, and after that let them relax in particular child portion. So they are saying after 4 months, pregnant women should avoid lying on their back for more than 30 seconds. Due to constriction of the vena cave, large blood vessel that runs from the legs to the heart, the vena cave is compressed by the weight of the baby, can be cut off oxygen to the woman and the baby. So where I found it, so they are mentioning कि जो back के साथ जो portions हैं, they can be do it, but it's not recommendable to avoid lying on their backs for more than 30 seconds. 30 सेकंड से ज्यादा मतलब कि बैक के साथ लेटना, that can be lead to any complication. And poses to discontinue: upward dog, cobra, wheel posture, unspotted back bend, headstand, and other complete inversion, intense twist, any back line poses, न्यू आर्म बैलेंसेस। बैक लाइन जो पोज है उसमें आपको कंफ्यूज नहीं होना है। अभी वी हैव सो मेनी अनदर मॉडिफिकेशंस व्हिच वी विल बी यूजिंग। ये नहीं कि बैक में इन्होंने बोल दिया 30 सेकंड से ज्यादा नहीं करना। सो वी विल हैव सम डिफरेंट मॉडिफिकेशंस, we will find out that different modification which you can be spotted. New arm balances or intense pose, stomach line poses, forward bend with the leg straight, and anything that doesn't feel good. तो ये आई थिंक यू ऑल नोज ऑल दिस प्रैक्टिसेस। सभी की प्रैक्टिस में आपको पता है, मींस कोई भी इंटेंस प्रैक्टिस वी कैंट गिव देम। एंड जो अपर डॉग है, जो लाइन विद द स्टमक के जो पोस्चर्स हैं, दैट कैन बी हैव टू बी अवॉइडेड। एंड इन्वर्जन पोस्चर्स हैं, दैट हैव टू बी अवॉइडेड। This is I'm sorry, twins or multiples. If in case woman has twins or maybe more than twins, so women carrying twins or other multiple will be larger than those with one baby in most cases. So third trimester modification will likely need to be started in the second trimester. सो इसमें ये बोल रहा है कि जो थर्ड ट्राइमेस्टर की जो मॉडिफिकेशंस हैं वो सेकंड ट्राइमेस्टर में भी वो कर सकते हैं. Third trimester precautions same as first and second. Give student permission to only do part of the class and rest in child pose. Often women no need poses to discontinuous. Discontinue downward dog, baby's head down, and the woman has large amount of fluid. Woman has heartburn. It stopped feeling good. Woman has high blood pressure. Baby is recently moved to a head down position from a bridge position. Woman has any eye condition that prohibited inversion. Legs separate wide enough for belly to fit comfortably with forward bend. When I will take you on the practical part, then I will be revise again on this point. अभी थोड़ा सा ये confuse हो जाएगा आपको. अभी जो whatever the part we are doing now, so when I will be take you on the practical part, from next week we will be focused more on the practical part. So practical part के अंदर जैसे जैसे when we will be go with a particular some sequence, many women get thyroid. What to do? Better to consult with the doctor. Doctor can better explain about. योगा के अंदर तो there are so many things which they can't do it. योगा के अंदर तो we can give them certain postures, some certain sequences on, and some basic pranayama we can be give them some neck stretch and some kind of breathing movements. So better to also consult with the doctor. So from the next week we will be start practicing as a sequence, and in that sequence that we will be take that topic again. What to do, how to do, what to avoid, and on which level have to be avoid. तो उसके साथ थोड़ा सा और ज्यादा हमारा okay. Yes, इसके बाद from the next week this is we starting with the, ये मैं आपको बता देता हूँ कि next week we will become on the asanas flow. prenatal yoga and asana flow हम नेक्स्ट वीक से चलेंगे इसके अंदर. सीटेड हैंड ऑन हार्ट, तो ये हम अगले वीक से हम इसके ऊपर चलेंगे, इस प्रैक्टिस के ऊपर. तो अभी तक आई विल बी शेयर वट एवर वी डिड अंटिल टुडे. सो मैं आपसे मैं शेयर करता हूँ, एंड फ्रॉम नेक्स्ट वीक वी विल बिकम ऑन दैट आवर प्रैक्टिस रूटीन. ओके गाइस, तो आप थोड़ी सी 5-10 मिनट की अपनी प्रैक्टिस कर लीजिए. आई नीड टू प्रिपेयर फॉर माय नेक्स्ट क्लास फॉर द पावर योगा. So give me permission and I will see you all in this batch in the next. So thank you so much. Namaste. Hari Om and Om Shanti.